Hello everyone! Welcome back to our channel. I am Dr. Isa, your Obgynoncall. Today we'll be discussing common contraceptive options for women. Whether you're in your 20s or 30s, it's crucial to understand the options available to you so that you can make informed decisions about your reproductive health. For this video, I'll be guiding you on the pros and cons of the different contraceptive options that you have, so you'll be able to figure out which option works best for you. But before we get started, let me emphasize that choosing your birth control method is a personal decision. Be careful in choosing your contraceptive method, or better yet, consult a healthcare provider so that you can find a method that best suits your lifestyle, preferences, and medical history. First up is oral contraceptive pills. Oral contraceptive pills can either be combined, meaning it has both estrogen and progesterone, or it can only contain progesterone-only pills. The progesterone component can inhibit ovulation by preventing the luteinizing hormone or the LH surge. It also thickens the cervical mucus, which provides a barrier from entry of the sperm, and it thins the endometrium. The estrogen component of the pill prevents a rise in the FSH or the follicle-stimulating hormone. It maintains the endometrium and thus prevents unscheduled bleeding, and it inhibits follicular development with the effects of progesterone. It is a very effective contraceptive method. It is effective up to 99.7% with perfect use and up to 92% with typical use. Combined oral contraceptive pills also reduces the risk for uterine, ovarian, and colorectal cancer. Some people find difficulty in complying with this method because you must drink it every single day at the same time to maintain the level of the hormones in the body. Common side effects include the following: nausea, spotting or bleeding in between menses. There could also be breast tenderness, mild headaches, or even very light periods or no periods at all. Common misconceptions of the pill include the following: OCPs do not disrupt an existing pregnancy. OCPs do not cause birth defects and will not harm the baby. Most women do not gain or lose weight with OCPs. And OCPs have no effect on the mood or sex drive. The pill can either come in a 21-day pill or a 28-day pill pack, and they're just the same. The 21-day pills contain 21 active pills, while the 28-day pills contain 21 active pills, and the last 7 days contain placebo pills or Ferris pills. If you have decided on using the pill, then you can use it within the first 5 days of the menstrual cycle, or you can use it anytime within the cycle. Use a backup method for the first 7 days. If you are postpartum and if you are breastfeeding, then you can use this method after 6 months. While if you are partial or non-breastfeeding, then you can use this method after 3 weeks. Both combined oral contraceptive pill and progesterone-only pills can be used right after a miscarriage if you are not desirous of another pregnancy. The subdermal implant contains 68 mg of etonogestrel and 60 micrograms is released daily. Since this is a progestin, it inhibits ovulation, thins the endometrium, and thickens the cervical mucus. It is more effective than permanent sterilization. It has a 0.05% typical and perfect use. There is very good compliance because of its placement, which is subdermal. You also have lighter or no menses, which means lesser blood loss monthly, so you can have better hemoglobin levels, and there's no need to purchase monthly menstrual products. This method can also be used when you are breastfeeding. However, like the pill, you have no protection against STDs. Menses might be unpredictable. Some may have irregular menses, some may have lighter bleeding, and some will have no menses due to the thinning of the endometrium. This is an expected side effect and it is not dangerous. Women with acne at baseline reported improvement, while very little reported worsening of their acne. Overall increase in BMI is only around 0.7 kg per meter squared, which is not a significant increase. You can have it inserted anytime within the first 5 days of your menstrual cycle, anytime as long as you are not pregnant, or anytime postpartum even when you are breastfeeding. The injectable, or the DMPA, which stands for dipomedroxyprogesterone acetate, is injected every 3 months in the deltoid, gluteal, or anterior thigh muscles. Again, this is a progestin, so it also inhibits ovulation, thins the endometrium, and thickens the cervical mucus. It is a very effective contraceptive method, and it is very easy to comply to since the injections are done every 3 months. It is easy to conceal and there is no foreign body that is inserted to your body. You can also have light or no menses, again better hemoglobin levels, less need to purchase menstrual products as well. Like the other methods, there is no protection against STDs. And unlike the other methods, there is slight delay in ovulation, usually around 6 months to 1 year. Some will experience an altered bleeding pattern, usually irregular bleeding that is usually light, but this decreases with each injection. Some may also experience weight gain, so there is around 4.3 kg increase in 5 years, and this may be greater for those who are already overweight at baseline. Some will also experience mood changes and headaches. This is also not seen in other contraceptive methods, but in this one, there is decrease in bone mineral density. However, with discontinuation, it will return to baseline after 1 to 4 years. We also give calcium supplements to those using this method so that we can prevent this. You can start anytime during the menstrual cycle as long as you are not pregnant. If you are postpartum and fully breastfeeding, then you can use this after 6 weeks. If you are partially or not breastfeeding, then you can use this after 3 weeks. And you can use this immediately after a miscarriage if you are not desirous of another pregnancy. This is an intrauterine device which induces a local inflammatory reaction to the endometrium, which makes it hostile to sperm. This is a copper IUD which releases copper ions that reduce sperm motility, and it also induces a local inflammatory reaction which affects the function and viability of the egg and the sperm. While the levonorgestrel IUD releases 20 micrograms of levonorgestrel daily. Levonorgestrel is a progestin, so again, it thickens the cervical mucus, thins the endometrium, and it inhibits sperm function. Since it is inserted inside the uterus, its effects are only local or only within the uterus. The levonorgestrel IUD is good for 5 years, while the copper IUD is good for 10 to 12 years. It can be used even if you are breastfeeding, and the levonorgestrel IUD can also cause lighter menses. Again, like the other methods, you have no protection against STDs. Insertion may also be a bit difficult for those who have not yet given birth. There are higher expulsion rates in adolescents. Copper IUDs may also cause heavier menses and dysmenorrhea. It is best to insert it when you have your menses. You can also have it inserted anytime as long as you are not pregnant. You can also have it inserted immediately after a miscarriage if you are not desirous of any pregnancies. And if you are postpartum, it can be inserted after delivery of the placenta, or anytime within 48 hours, or after 4 weeks of a normal delivery. It can even be inserted during your cesarean section, or 8 weeks after your CS. So there you have it. There are so many options which you can choose from. And here are some factors that you can consider when choosing a birth control method. You have to consider the effectiveness, convenience, side effects, whether you want a long-term or a short-term contraceptive. You also have to consider the different comorbidities that you have. You also have to consider protection against sexually transmitted diseases. Privacy and discretion must also be considered, and the overall cost that you will have to set aside for these contraceptives. And that's it for our discussion today. We hope that you enjoyed exploring the different birth control options that you have, and I hope that you figured out which birth control method is the best for you. If you are still unsure of which contraception to get, it's okay to take your time. You can also consult with your OB-GYN to know which one is best for you. Taking birth control affects your overall well-being, so it's better to get something that works best for your body and lifestyle. If you found this video helpful, give this video a thumbs up, and don't forget to subscribe to our channel if you want to see more videos about sexual wellness. Once again, I am Dr. Isa, your OB-GYN on call. Remember to like and subscribe. You can also check my TikTok account at obgynoncall.ph for more OB-GYN, reproductive health, and sexual health content. Until next time, bye!